Hello, we are presenting Humanism Crime Center, and we are Tiffany, Courtney, Brayson, and Young. Okay, practice principle. We have three principles. First, personal and social problem occurred when people are devalued. Change happens in the context of an authentic, helping relationship. People are capable of self-actualizing when the conditions allow positive growth and change. The client problems are caused and exacerbated when people feel devalued and when lack power and control of their life, resulting from the problem of self-image, are thought to cause dissatisfaction and potentially problem in relationship or with mental health. So these problems suggest social workers consistently communicate a sense of inherent dignity and worth to avoid continual oppressive treatment. Facilitating self-determination and choice are also essential to client-centered therapy. Uh, the theory suggests change in client is forced not by technique but rather through the context of developing a professional relationship that's validating and communicating unconditional positive regard. So provide a safe process that allow client to walk through the problem they face. Um, Social worker create a condition where it allow the client to be authentic, take risk, and foster growth. So the core condition allow for the counseling process for client to achieve personal growth and development. Roger believed that when people could process through past hurt and discard negative message, they could accept the past using lesson learned to develop insight and goal. So social worker responsibility is less about solving problem and more about creating the condition that can facilitate growth and healing. Social needs and to be mindful of situation that hinder self-actualization and advocate change, leading to free and open change. Okay, practice setting. Practice setting, the approach can be practiced across multiple social work settings and at all three levels, micro, meso, and macro of social work practice. Seem useful being engaging in cross-cultural work, offer an important framework when working multicultural setting. According to Michael Hurt, the client-centered therapy may be used as a treatment component for individuals with any type of condition or disorder that would benefit from traditional talk therapy or psychotherapy, outpatient residential treatment program for the variety of addiction, compulsion, and compulsive behavior, mental health disorder. Our client-centered approach is cross-culturally beneficial because Roger did not intend to be for the special age group or subpopulation, but has been used to treat a broad range of people like individual, group setting, family setting, prayer therapy. Client-centered approach is used to provide component and effective treatment system for racial, ethnic, minority client and family. The approach focuses on positive regard for the client and use a non-hierarchical approach when the therapist is non-judgmental and empathetic so that the client is able to reach their actualization. The strengths consist with the NASW mission and core value. It can be applied across multiple social work settings and at all three levels can direct how they view purpose in value context, can inform interaction with child, adult, family, and community, seem useful when engaged in cross-cultural work, offer an important framework when working multiple cultural settings. So personal-centered therapy can be described as a non-directed, client-centered, humanistic, Rogers and relationship therapy. According to Rogers, the internal frame of reference of the client to perceive the world as the client sees it, to perceive the client himself as he is seen by himself, to lay aside all perception from the external frame of reference while doing so, and to communicate something of the empathetic understanding to the client, can inform interaction with the child, adult, family, and community. According to Roger, the counselor is responsible for setting the three core conditions in the relationship that will free client to cure themselves and move toward great self-direction. A fundamental Rogerian belief is that people are basically good and will move toward self-actualization. It provides a situation in which they can be free to be themselves and where love and understanding are present. Okay, limitation by Young. First, it is simplistic with few guidelines from social workers who for practice. It's not enough time within certain social worker setting. Lack of empirical evidence. It's challenging for therapists because a lack of therapeutic technique, a heavy reliance on the therapist's ability to consistently be non-judgmental, unconditional, accepting, and empathetic with their client. Some clients are not motivated just by caring and listening for any reform to be with. The approach can be too simplistic, optimistic, leisurely, and unfocused for clients in the crisis or who need more structure and direction. This is from the positive psychotherapy Silverman. Other approach is more attitudinal than the technique based. It void of specific technique to bring about client change. Other approach depend on bright, insightful, hardworking client for best result. It has limited applicability and is seldom employed with severely disabled or young child. Okay, that's the reference is here. You can look through it. Thank you very much for your listening.